Welcome to another edition of the Public Interest. My name is David Granger, and on this series of programs, we examine issues which are of interest to the Guyanese public at home and in the diaspora. And one of the problems we tend to ignore, although it's very serious, is the question of disease, particularly vector-borne disease. And if someone was to ask you what is the most dangerous, the most deadly animal in the world, some people might be tempted to think, oh, we have jaguars or elephants or snakes. But in fact, the most dangerous animal is one of the smallest, that is the mosquito. The mosquito is the most deadly animal in the world. It kills more persons than any other creature in the world. The simple mosquito, and of course, Guyana has lots of them. And when you talk about disease, especially fatal disease, you're talking about chikungunya, you're talking about dengue, you're talking about filaria, which Guyanese grew up learning to call Bigfoots. You're talking about malaria, you're talking about yellow fever, you're talking about West Nile fever, you're talking about Zika. These are all diseases which are the result of infection by mosquitoes. All these are killing diseases, and Guyana is not doing so well, despite our proclaimed wealth. We're not paying attention to the people who are becoming ill and who are dying from these diseases. We recorded 108,000 positive cases of malaria in the period between 2020 and 2023. In 2024 alone, we had 24,000 cases of malaria. And you're talking about 2,000 a month in this small nation. In fact, it is the highest rate of disease in the Western Hemisphere. The highest rate of disease of malaria infection in the Western Hemisphere. And in terms of dengue, we had 19,000 cases of dengue and over 190 cases of filaria. So you can see the vectors, these mosquitoes, are wreaking havoc in your country. And our death rate is 51 by these vectors. 51 people were killed, died. They're not traffic accidents. These are mosquitoes over the last 3 years. Vector-borne diseases, which are, of course, diseases which affect humans, and they're caused by parasites, viruses, and bacteria, which are transmitted by mosquitoes. And this is the problem. There are several mosquitoes, the Aedes aegypti, which is perhaps it's difficult for us to recognize them, for many Guyanese, a mosquito is a mosquito. But you have the Aedes aegypti, you have the Anopheles, and you have the Culex, which are the three most dangerous vectors. And these vectors, worldwide, Guyana is bad, but in other countries of the world, Africa and Asia particularly, there's 700,000 deaths every year. This is according to the World Health Organization. So vector-borne diseases are not diseases which we can ignore in Guyana, countrywide. It's one of the biggest threats, particularly in the four hinterland regions, the Barima-Waini region 1, the Kuyuni-Mazruni region 7, the Patara-Siparuni region 8, and the Rupaluni region 9. But there are also areas of region 2, the Pomeroon-Supinam, and of course region 10, the Upper Demerara Berbice region, which are affected by these vector-borne diseases. So in fact, it's not 4, it's probably 6 regions out of Guyana's 10 regions which have serious infection by vector-borne diseases. So malaria, as you know, is endemic, and many people used to die of malaria. And of course, in the 1940s, we had the benefit of an Italian doctor, scientist called Sciglioli. And of course, the British, because the British were at war with Italians, during the Second World War. And of course, Dr. Giglioli, who was in Guyana working to eradicate malaria, he was imprisoned. Not because he did anything, because of who he was, not because of what he did. He was an Italian, and regardless of the fact that he was doing good work, they imprisoned him. But I think people understood, and when he came out, he continued his work, and he helped to bring malaria under control. And malaria at that time was affecting a lot of people on the coast. Anyhow, malaria is endemic in Guyana, and in the poor hinterland regions, 178 and 9, about 80 to 90% of the cases were recorded, particularly in logging and mining areas. So when we hear about, gold and diamond, you know, rates of production and the amount of logging we do, there is a darker side to mining and logging in Guyana. A lot of people die in those very areas, and you will know why. Our constitution, and we must respect the constitution, it is the supreme law. It provides that the state shall protect the environment. This is mandatory. The state has a mandate to protect the environment for the benefit of present and future generations through reasonable legislative and other measures designed to prevent pollution and ecological degradation, to promote conservation, and to secure sustainable development and for the use of our natural resources, while promoting justifiable economic and social development. This is the Constitution. This is a mandate of the Constitution. Further, it states that everyone has the right to live in an environment that is not harmful to his or her well-being. So the state should protect us, not just protect the place, the environment, but protect our lives and well-being. Does it happen? My friends, the question of dengue and filaria and malaria have been reported over and over again. The questions have been answered. We know the cause, we know the location, but in fact, for some reason or the other, we are not dealing decisively with the question of vector-borne disease in Guyana. We know what the Constitution says, that the government is mandated to ensure that it improves the environment and protect the health of the nation. It has to preserve clean air, fertile soils, pure water, in order for the rich diversity of plants and animals and ecosystems to flourish. Our government, the APNU government, between 2015 and 2020, that 5 year, although the 5 years were cut short, as you know, by a vote by Charan Das of the Alliance for Change, who was one of our coalition partners at that time. It was cut short. It was really a 3 year, a 3 year government from 2015 to 2018. After 2018, as you know, there was a legislative and constitutional turmoil. But we were successful in that 3 year tour to establish a Department of the Environment. We actually created the first Department of the Environment, and we launched a Green State Development Strategy, Vision 2040. So we were concerned about the environment and the harm that could come to our citizens if the environment was not protected. What happened to the Department of the Environment? What happened to the Green State Strategy? Well, the PPP got into office in August 2020, and it broke up the Department of the Environment. They shunted it over to the Ministry of Natural Resources. So instead of having an independent, almost an autonomous, almost a ministry looking after the environment, it is now incorporated into the Ministry of National Resources. Nobody hears about it anymore. I know from time to time some NGOs complain about the EPA, but EPA is different from the DOE, the Department of the Environment. And what has happened to the Green State Development Strategy? Well, like all the initiatives advanced by the APNU EFC coalition, it was thrown out of the window. And the PPP administration just recovered its old low carbon development strategy. And they wanted to make money. I don't think they're keen on protecting lives. They're keen on making money. Well, I admit that, they make money, but a lot of people are still getting sick, getting ill, and a lot of people are still dying. So they discarded the Green State Development Strategy, and they demolished the Department of the Environment. And as you can see, that department or those functions have been lost, and the thrust, the initiative to go into the hinterland, to go into these areas and protect the environment has diminished. There's no secret about that. You don't hear about, forcing these miners to cover up the holes and get rid of the old equipment. You don't see any action taken about making sure that the rivers are not contaminated and the trees are not, are replanted in those areas. We just fly over Region 8. Next time you visit the hinterland, fly over Region 8 and see what is happening. The country is covered with sores, it's covered with abscesses. So although people boast about, gold declaration, you can see what is happening on the ground there, see what's happening to the people who live in Region 7, Region 8, particularly along those riverine areas. It's costing us. The wealth of a few is derived from the poverty of the many. And that is a great shame. That is what is happening because the PPP administration is not really concerned about protecting the environment. They're concerned about profits from the environment. And it's not concerned about the Green State Development Strategy. It's concerned about the low carbon development strategy. It's quite clear. Nobody takes the time to read or to understand what the Green State Development Strategy is all about, or what the low carbon development strategy is all about. And sometimes, unfortunately, I don't think that some of our media operatives really ask questions. Why are we going along with this program when so many people are dying because of vector-borne diseases? Take some photographs to the next press conference and ask the government to account for these big holes in the ground and the disease that is caused by the mosquitoes, which are finding places to breed their larvae in these areas. My friends, the increase in vector-borne diseases is linked. Yes, it's linked to climate events, but it's also linked to urbanization. It's also linked to poor waste management. These are the reports of PAHO and WHO, the Pan American Health Organization, World Health Organization. And these vector-borne diseases and these areas and these events, urbanization and poor waste management, create conditions for mosquito breeding. Vector-borne diseases are caused mainly by mosquitoes, not because the country is getting hot or cold, climate change. It's mosquitoes. We know what they are. They're the Aedes aegypti and the Culex and the Anopheles mosquitoes. Those are the main culprits. They thrive in habitats which are created by reckless disposal of receptacles, solid, single-use plastic, SUPs, plastic bottles, food boxes, styrofoam food boxes, coconut shells, old vehicles, containers and tires. When you look at the unregulated waste, sometimes you go into a community and you see these roadside dumps. Nobody cleans them up. Stagnant pools of water in congested canals, drains and trenches. Sometimes there are excavations for road works or buildings, and they leave huge holes. Mining pits. Mines take the gold and they're gone. They leave these big holes in the ground. That is where the mosquitoes breed. And, fighting down municipalities, fighting down neighborhoods, talking about, management, when we know that some of these neighborhoods don't get enough money to look after solid waste management. The municipalities don't get enough money to ensure that, the garbage is collected and dumped properly. And as a result of that, regardless of the $1 trillion budgets, we don't have a clean environment. We don't have a safe environment. And this is a responsibility for central government. We know that regions and neighborhoods and municipalities do not have enough funding to keep their environment safe. And definitely, the big mines, the bauxite and gold mines in the hinterland, are not being made to ensure the environment is safe after they've mined the minerals. We have these big holes in the ground, and our children will inherit holes. They will not inherit wealth. My friends, environmental mismanagement is one of the biggest problems that lead to death by vector-borne diseases. And we know the culprits, the Aedes aegypti, the Anopheles, and the Culex, are the main vectors which bring chikungunya into the country, dengue fever, lymphatic filariae, malaria, yellow fever, West Nile fever, and Zika. And of course, we know that there are problems in the borders. And if you do not control your borders, you will have problems with vector-borne diseases. You'll have Venezuelan migrants coming into the country. It's hard to convince anyone that those 34,000 migrants who come into the country have been properly vetted for malaria and other diseases. So even though Guyana might try to control the vector-borne diseases within the country, we're always being reinfected by people coming over the borders, particularly from Venezuela and Brazil, because we do not have an effective or efficient border security system which ensures that persons coming into this country do not bring disease into this country. That is a big problem. So we have backtracking, and everybody thinks it's a joke. It's a Guyanese joke, backtracking. But people who can come into the country without being examined or screened can also bring disease. It's not just a matter of bringing in cocaine or bringing in, illegal firearms. It's also bringing disease. That is the problem. Just not just contraband. Disease is the biggest contraband, quite frankly. So, what are we going to do about it? We know that, reckless environmental management or mismanagement caused by economic exploitation. Yes, we need the gold. We need the revenue from the gold. We need the revenue from the diamonds. We need the revenue from timber. But some of these enterprises do not clean up the mess that they make. Sometimes even trading, tourism, people just dispose of the single-use plastics. They leave old tires, old equipment, and it's broken down. They just leave it there. Boats, which are of no more use, they just leave, and they accumulate water, and the mosquitoes breed there. So many of the areas, many of our ports and stellings, we are very, we're the land of many waters. Well, some of those waters breed mosquitoes. And many of the stellings at Bartica, at Charity, at Cariveton, Esquibo Islands, at Leguan and Wakinam, Hog Island, at Kumaka, at Parika, many of these areas are polluted, they're contaminated, and mosquitoes can breed in these areas. Who is responsible for this mess? Who's going to clean it up? Well, the public health system, as you know, when the APNU was in office, it changed the name of the ministry to the Public Health Ministry, the Ministry of Public Health. And these functions are vested in the Ministry of Health, which is what it's called now. But right now, under the Constitution, you have to go all the way back to the office of the President. And in accordance with the Environmental Protection Act, that act states clearly that it is responsible, or the government, whoever is responsible under the act, for providing for the management, conservation, and protection and improvement of the environment. Management, conservation, protection, and improvement. Listen to those words carefully. Management, protection, conservation, and improvement. Not exploitation alone, but conservation and protection. It must control, the state must control pollution. It must ensure that the impact of economic development is not harmful to the residents. We want to use the environment sustainably, but we must protect the human beings who live there, and of course, the country as a whole. It is a sad situation. I have personally met young people straight out of high school, just past CXC, into the hinterland, into some gold mining area, and in a few weeks' time, they're back out. Yeah, not the school, but the hospital, because they're suffering from malaria fever. That is what is happening, because the hinterland is still a hotbed for vector control, vector-borne diseases. APNU AFC worked hard to get rid of this scourge. We established the infectious disease hospital. We, we established it, although this administration pretends that they established it. It was there. As soon as they got into office, they started to criticize it, and then they realized that this was needed. It was needed since 2005 when we had the first great flood, and people were suffering from leptospirosis. They did not establish it. The APNU established that hospital, infectious disease hospital at Liliendal, and it was open before the government was handing over to the APSC. And the theme was symbolic. The theme was, it still resonates today. Little mosquito, big problem. That was the theme. And it is perhaps an international theme, but we use the theme. And it was aimed at increasing knowledge about malaria, these vector-borne diseases. And we have initiated and continued international cooperation. I personally, in London, attended the Malaria Summit in 2018. I attended the Malaria Summit, which was promoted by Bill and Melinda Gates. I did propose at that conference, that summit, an international support strategy directed to protect our citizens against the spread of malaria, to prevent and limit vector-borne diseases and infections, and to disseminate quality health information, and to provide improved tools for diagnosing and identifying active cases, and to procure high-quality combination treatment for dealing with malaria, diagnosing and identifying the case of malaria, and dealing with curing infected persons, and of course preventing malaria from being so endemic that it becomes resistant to drugs. And it is possible. As a young officer going into the hinterland, we had to take our prophylaxis in terms of chloroquine and camoquine tablets. I don't know if they're still effective today, but every soldier under my command had to take those tablets when he went into the hinterland. When I was trained in Nigeria, of course, Nigeria at that time, I don't know now, but it certainly had a malaria problem. And every day you took your prophylaxis. Just like you have breakfast every day, you have to take your prophylaxis against malaria. We have to become serious again about that. When I was a young officer a long time ago, 60 years ago, this time we have to make sure that we have a campaign against malaria, and we have a Department of the Environment which protects the environment and eradicates those areas in which the vectors breed. My friends, Guyana is a signatory to many agreements, and one of them is the Amazon Malaria Institute, the AMI. Maybe you never heard about it. And it supports vaccinations, it supports medication, it supports measures against malaria because malaria is transnational. We get it from other countries. And we are part of the global program to eliminate filaria, lymphatic filariasis, which is established by the World Health Organization to stop the spread of infection. And we must be conscious about of the need to cooperate with international partners to prevent the spread of these vector-borne diseases. We cannot do it alone. And neighborhoods cannot do it alone, households cannot do it alone, regions cannot do it alone, municipalities cannot do it alone. We need to have a collective effort to overcome the problems caused by vector-borne diseases. What is the way forward? We have to deal with vector-borne diseases at various levels. It is a severe, serious, grave environmental hazard. There must be education at school, in the home, children, parents, everyone, business places must be taught about the dangers of infection by vectors, by these mosquitoes. There must be an eradication campaign so that we remove the breeding sites for these vectors, and we ensure that our officials are trained. And we have to send officials into the hinterland. My friends, we set up the APNUFC administration, created what is called the Corps of Wardens. These were trained persons. Sometimes they had to be armed, but they went in to make sure that the mines were safe and they weren't breeding grounds for death of young miners. And you can still see in Guyana, we still are losing a lot of young people in those mines because there's no supervision, there's no inspection. The Guyana Geology and Mines Commission cannot do it. That's why we created an enforcement agency called the Corps of Wardens. But of course, when the PPP got in the disband, they just shut it down. Right now there's a free for all in the West Guyana, west of Port Island, a free for all. People still dying in the mines. People still dying from malaria. And we had a corps of trained officials who would go into these communities and make sure not only that they enforced the law, but they also conducted tests to diagnose for malaria. And anybody coming out of the hinterland of Guyana should be subjected to these tests to see they're not carrying the parasite. And of course, they provide insect repellents and mosquito nets. I speak out of experience because as a young officer, you know, in the 1960s and 70s, we had mosquito nets and we had insect repellents and we had to be tested. This is nothing new. And that's how you bring the disease under control. Not by just boasting about, gold decorations and how many cubic meters of logs, but how you protected the environment, how you protected the human beings, the soldiers and the residents of the hinterland. There must be better coordination between central government. Central government must not fight down the neighborhoods and the municipalities. Every day there's some war between central government and some town council. You have to work together to overcome this menace of vector-borne diseases. The central government has to work with the administration, not just win elections and go into these communities and sort of boss around and decide, who gets what, where, when, and how. But you need to work together. We're all Guyanese, and we all need to be safe. And every region must have a plan to deal with vector-borne diseases. There must be a higher level of collaboration within Guyana between the various agencies at neighborhood, village, regional, municipal level, and at border locations. We need to ensure that every border location is staffed with people from the public health, with vector control service to make sure that we're not bringing disease into the country. We need strong legislation so that people who are involved in illegal trade, wildlife, and people going into the hinterland and exploiting our resources are not also creating problems for the residents. We need now, my friends, to think about the way forward. Vector-borne diseases are taking their toll on Guyanese. Human beings are dying, are becoming ill because of malaria and filaria and dengue. Look at the newspapers. This is not a secret. This is not political propaganda. Guyanese are suffering because of these vector-borne diseases. The ministries of Amrina Affairs, of Health, Home Affairs, local government, regional development, natural resources, these ministries have to combine their efforts to bring an end to vector-borne diseases. And we need to do what the Constitution tells us to do: keep the environment safe, to protect it for this present and for future generations. Our children deserve to live in a safe and healthy life and a safe and healthy country. And right now, unfortunately, the neglect of the danger that is posed to our population by vectors, the mosquito, the deadliest animal in the world, has to be brought to an end. Mosquitoes have to be eradicated, and Guyana must be made safe from vector-borne diseases now and for the future. Thank you, and may God bless Guyana and our children.